In many ways, we are interested this morning in learning about columellar struts. If you are seeking a rhinoplasty consultation, you may hear about that, and I'd like this morning to explain what that is. Again, we must understand nasal anatomy before we can understand what a columellar strut is. This graft particularly relates to the lower third of the nose. There is an upper third, a middle third, and the lower third, which comprises cartilage, and it is called the tip. This cartilage, called the lower lateral cartilage, looks like a horseshoe bent 90 degrees. The horizontal part is located right here, and you can often feel that, and then it turns around 90 degrees and it forms two parallel pieces of cartilage down in this region. That region, which you can put your fingers in and move, is called the columella. So we've got two pieces of cartilage that are parallel to one another, and in many ways they form a vertical beam that is responsible for the projection of the tip. So if I turn my head here, you can see that as I push down on the tip of the nose, what is responsible primarily for pushing back is the two cartilages right here. Now, in patients who need further support of those two cartilages in the columella, a physician can insert a columellar strut. What that is a piece of cartilage taken from elsewhere in your body, typically from the septum, which separates the right and left nostril, and that cartilage is sculpted and fashioned and fit between those two parallel structures. Therefore, it reinforces those two medial crura, those two vertical pieces of cartilage, and therefore when you press on the tip, it will be a little bit more firm, and this helps in the projection and the maintenance of the projection of the nose.